And as those cases continue to rise, officials say there needs to be more testing in rural areas where the virus may be spreading undetected, and communities are already at a disadvantage because of lack of medical facilities. Local health systems are helping these communities keep up with the spread so they can contain it. Fox Carolina's Matt Kaufax live near Prisma Health in Greenville with more. Matt?
Yeah, Cody, Prisma Health tells me that one of the biggest boosts to their rural testing has been the community pop-up site initiative. At least one day a week, they try and pinpoint a specific area in our region that is considered rural. Some doctors still say, though, that despite increased testing, some of these areas are still in danger of being left behind. Kevin Bennett, a professor at USC School of Medicine, says his biggest fear is that rural areas won't bounce back post-pandemic.
I fear that we're going to see practices close, clinics close, home health agencies close.
He and Carrie Cease, medical director for Prisma Health's Bradshaw Institute, say they are already at a disadvantage to begin with.
There are a lot of places that don't have a physician in the county, for example.
There can also be disparities with chronic disease and mental health.
Testing in particular has been a big issue.
Some of these folks who live in these rural areas are some of our essential workers, farmers. And so if they get sick, and it wipes through a whole area.
This kind of thing could have the potential to really decimate a rural community.
At first, rural communities seemed insulated enough, but Cease and Bennett say they've since caught up and in some cases surpassed metro areas.
If we can go in there and figure out who's positive, then we can talk about quarantine and isolation and hopefully spare the whole community.
Prisma in particular has taken on the challenge of going into rural areas with their community testing initiative.
Trying to find areas, oftentimes a school setting, where we can go and set up testing where people can walk to those sites or have a short drive.
In just a few months since it started, Cease says they've tested 17,000 plus at 40 different sites.
We're testing on the magnitudes of 500 and 550.
Meanwhile, Bennett is thinking big picture. He says the state should pump more money into these areas down the line to avoid problems like this in the future.
I've been trying to say, we're not rebuilding rural. We're reinvesting in 20 to 30% of our state that is underfunded and underempowered.
Prisma Health's next testing site, their pop-up community drive-through testing site, will be next Tuesday in Seneca from 8 a.m. to 8 a.m. to noon, and it'll be at Seneca Middle School, they say. Cease tells me that they are still looking for approval from DHEC for other testing sites, but especially after this weekend, we've heard some people setting off fireworks just behind us while we've been out here reporting to you live. She says after the 4th, some of you may need this, so be on the lookout. In Greenville, Matt Kaufax, Fox Carolina, the 10 o'clock news.